Come again.
Hello, and welcome to the American Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the American Massage Conference May 20th through 22nd, 2011. The inaugural event is being sponsored by Massage Today, Massage Envy, Massage Warehouse, and ABMP, and will be held in beautiful Atlanta, Georgia. Our special guest today is Tina Allen. Tina and I will be talking about her class at the American Massage Conference, Pediatric Massage, highlighting massage for autism and ADD, ADHD. With over a decade, before we get started, I would like to tell you a little bit about Tina. With over a decade of service to children and families, Tina Allen, founder of leading children's health and nurturing touch organization, Little Kids Foundation, has become internationally respected as an educator, author, and expert in the field of infant and pediatric massage therapy. Ms. Allen managed the United States' first comprehensive pediatric massage program at Children's Hospital in Los Angeles, where she trained volunteer massage therapists and medical professionals to work with hospitalized rehabilitation patients, medically complex infants in the Center for Newborn and Infant Critical Care, neonatal intensive care unit, children with retinoblastoma, hope I got that right, Tina, spina bifida, and cerebral palsy. She has developed pediatric massage programs at Mattel Children's Hospital at UCLA and Cedars-Sinai Medical Center, as well as developed a program focusing on introducing gentle, compassionate touch to women and children who have survived domestic abuse. Tina is currently consulting on the development of comprehensive pediatric massage programs for the Mayo Clinic, Nemours/Alfred I. DuPont Hospital for Children, and Connecticut Children's Medical Center. Well, that was a mouthful, Tina. I hope I got it all in there. Anyway, Tina, thank you so much, and welcome to the American Massage Conference pre-conference broadcast series. I'm really interested to talk with you today about your class, Pediatric Massage, highlighting massage for autism, ADD, and ADHD.
Thank you, Felicia. See, now you've got me saying things incorrectly. See what happens? No,
well,
you
good.
said everything perfectly, and I'm really happy to be here. Thanks so much for having me.
Well, we're really glad to have you. And before we get into our topic, or your topic, I'd like to ask you, what exactly was it that made you decide to get involved with the American Massage Conference in Atlanta?
Well, when the organizers contacted me to share information that this conference was happening and asked if I would be a part of it, I immediately said yes. And then there was the, wait, we want to tell you about the conference. Working with the organizers in the past, it's been an awesome experience, so I was not hesitating at all to want to be involved in something of this magnitude. But then to hear more about it, I even got more excited. There's so many wonderful presenters and educational professionals, healthcare professionals coming in from all over the world to share their expertise at this event. It's really exciting, and to have it in Atlanta, even more so. Atlanta is one of my favorite places. So to have an opportunity to go to Atlanta and then be around all of these wonderful people, I'm all on board. I'm really excited for the event.
Well, I agree with you completely. I felt the same way when I was introduced to the conference and the possibility of being a presenter. And I think just the culmination of all their hard work, along with the information that all of the presenters, including yourself, will be there to provide, as well as all the fun that's going to happen. It's just going to be a great time.
Absolutely. It's really going to be a fantastic event. It's actually surprising to me. It's the very first one, so I'm looking forward to this, and then I know there will be so many more in the future. It's really, really wonderful.
Well, it is exciting to be a part of the first of something. I know a lot of presenters have mentioned that was an exciting part for them. Is there anything in particular as far as an event or an activity that you're looking forward to at the conference?
One of my activities I think I'm looking forward to the most is just connecting in person with all of my colleagues and people that I've been keeping in touch with sort of on social networking sites like Facebook and emailing back and forth and the occasional telephone call. All of us are so busy traveling and teaching and sharing information that there's not a lot of downtime where we can all get together in one place and just hang out and have hugs and talk about what we've been doing all year. And so I'm really excited for that. And then I'm also really excited, I think, about having all of the different massage therapists that are coming from all different walks of life, all different modalities, but even the massage therapy students. I know the organizers have been doing a lot of work to go to massage therapy schools and try to encourage students and those people entering the field of body work to come out to the conference. And that's really exciting to me because I know lots of conferences I go to, there are massage professionals and people that have been working in the field, but not as many students present or not as many people who are not yet licensed or certified. And this event, it's so cost-effective, it's attainable, you can come to it. And I know that there's always been a hesitation, I think, for students to come out to continuing education events. They're thinking, oh, well, I don't need the CEU credits until I'm already licensed or certified. But it is really important to come to events like this, and I think that this conference is really making a push for that. And so I'm really excited to meet all the new and up-and-coming body workers who are entering our field. That's really going to be interesting for me.
I think it is going to be fun, and I think that focus is definitely something exciting to have the new therapist there. Being someone that's attended the Canadian Massage Conference, that is what this conference is modeled after, their involvement and focus on the students is so exciting to watch and to be a part of. I wasn't a presenter at the student day, but I did kind of observe it in Canada, and the students were thrilled to be there, and they really got excited about all the things that they could learn and all of the vendors that they could come in contact with, and just the opportunity and experience to get to meet some of their mentors, people that maybe they don't even know they're their mentors yet. So I think you're
absolutely.
right.
And because I was thinking about that, when I was in massage therapy school, I don't remember an event that really became accessible to the students, and so we didn't have an opportunity that we knew about to go out and meet those people that you read about in the magazine or that you see on the internet. And so it's exciting to have everybody in one place all together.
It is. Well, I know that we're both going to have a good time. I know that I'm excited to get to meet you in person after talking today. I know I'll want to put a actual live face to the voice, not just the one I see on Facebook. So
that's right.
Well, I don't want to delay in talking about your topic because I know that people are tuned in and want to learn about pediatric massage. Can you tell me a little bit about what pediatric massage is and how you became interested in it?
Absolutely. One of the things that's well known, I think, in massage therapy that's becoming more well known is infant massage. And that's great because infant massage is a little bit more mainstream now. It's falling in line with lots of other modalities in the massage therapy realm that people are familiar with. But pediatric massage, not as many people know about it. It's becoming more well known. And the great thing is the healthcare team, the healthcare environment has embraced it, which is really exciting. Pediatric massage is a focus using massage therapy and body work techniques with children. And so I mentioned infants, and so pediatric massage has often encompassed infant massage and been under the same umbrella, which they do fit under because they are working with children and families. But pediatric massage is more of a focus from the toddler stage up until maybe if they are seen in a healthcare environment when they're discharged from the hospital. And that could be anywhere up to late adolescence, or I've even seen children in the hospital that are 23, 24 years old. But because of their diagnosis, they may cognitively be different. Their development may be that they're more at a different age level as a child, or their specialized diagnosis has caused them to be in a healthcare environment for a longer length of time and needing to be followed by specific specialists. So it's a different field. It involves working with children and understanding how to interact with children, but also thinking about working with the healthcare realm, and that's a really important duo to have those two things, to have that background to be able to do that. And then I became interested in pediatric massage way back when I was just finishing up massage therapy school. I actually started volunteering with different population, with adults, and adults that were considered to be untouchable. mainly the diagnosis I would see were people with AIDS or HIV, lots of seniors in senior residences, or people with cancer or in hospice care. And for many reasons, they wouldn't have visitors, or people were scared to touch them. Even their own loved ones would be afraid to touch them. And so I started volunteering, thinking that I was helping these people that were considered untouchable to receive touch, and actually I gained so much from the experience. I started canceling all of my paid clients so I would have more time to volunteer. So it became one of my passions to do that, and I realized in doing that work I met lots of different people in healthcare and physicians and nursing staff and even families who would talk to me and sort of ask about my background. And one of the things I was pursuing at that time was also pediatric occupational therapy. So I always thought that I would use massage therapy with pediatric occupational therapy as an adjunct therapy, and I would use these things together. So it was, I think, shocking for some people, and I remember people saying that it was, why are you in a senior residence? Why are you at an old folks home if you want to work with children? And so I would share information about the research and things and ideas I've been thinking, and I'd have families start to say, well, my child has this diagnosis, will you consider working with them? Or I had physicians that would say, well, there's a child under my care that could benefit from massage therapy, can you work with them and their family? And it just started that way, sort of one case at a time. And you see the results working with children really, really fast. And it's one of the things that I didn't realize it until I started doing that work, that this is where I needed to be. This was what I needed to be doing, because you see the children respond and you see the families get so excited when their child finally speaks, if they've been nonverbal. And one of the things that helps them to do that can be massage therapy. And I've had parents, I'm working with a child, and I'll provide some massage and some touch therapy, and I'm sitting with mom or dad. In one specific case, the little girl never spoke, and at the end of massage, I was talking to mom, and we were sitting there, and the little girl just started to say more. And mom just teared up because I didn't know all of that background. She never spoke. And wow. So it's awesome, and it just, every time those things happen, it just re-inspires you to keep wanting to do more.
I'll bet. You've really kind of taken my breath away with that story, and I guess as long as I've been in massage therapy, I really hadn't considered this aspect of how it can be helpful. My practice is pretty much, okay, I have clients that come in for relaxation and a little bit of pain relief, or maybe the reverse, pain relief and a little bit of relaxation. Right. But it sounds like you've really got a passion for doing some deep, deep work, and that's what you're now teaching people.
Absolutely. And it's even just at a class, I just had a class up in Vancouver where a mom came to class, the entire course, because she wanted to learn about her daughter had just been recently diagnosed under the autism spectrum. She wanted to learn more about that and how therapies might be beneficial. One of the things that she shared in class is that her daughter doesn't like to hold hands, because if mom reaches out and holds her hand, she'll start screaming, and she seems like she's in pain. So she walks next to her daughter, and she'll have her hand available, and her daughter can touch mom's hand if she wants to. But it's really up to her. And so during class, I showed them on that first day a few techniques, and one of them was a hand massage. She shared the next day that she went home, and she asked her daughter, can I try this, what I learned at school today? And her daughter let her. And then she actually put out her other hand and asked her to do it. And then at bedtime, she asked her to massage her hands again. And so mom was just amazed, because she'd never had that happen before. She wouldn't even let her hold her hand. So to be able to go home and use massage and then have parents come back and tell me things like that, it's just awesome.
It sounds like it. I can really see why you are so enthralled with that, and I'm jotting down all these notes, thinking I'm not even sure what questions to ask, which is absolutely a first in this interview series. Right. I guess the first thing I would ask is just going and looking at the class that you're teaching, and specifically wanting to know, why did you pick ADD and ADHD as well as autism to focus on? Because it sounds like there's lots of different conditions, but why did you pick those as a focus?
I chose those, I think, because lately I've been getting so many inquiries from families and also professionals and wanting to work with children that are on the autism spectrum. And one of the things that I've discovered in all of my research is, of course, so many different diagnoses, like you mentioned, that can benefit from massage therapy. And ADD and ADHD, there's lots of research in that area, and there's more and more growing in the autism spectrum area. But oftentimes, and people don't necessarily know this, that's a co-diagnosis very often. Children will be somewhere on the autism spectrum, and they'll also have ADD and or ADHD. And so there's lots of different symptoms that affect these children that have this diagnosis. And sometimes there haven't been an official diagnosis. Maybe parents think that something might be going on with their child, and so they go on the internet and they read things, or they talk to other professionals, and they've sort of self-diagnosed. So these might even be clients that you might work with pediatric massage. But this diagnosis is growing at an enormous amount. I find that even every time that I teach courses on autism or ADD, ADHD, I have to look up the rate of where we're at. What is the Center for Disease Control saying today? Because it changes every day. And just my last class, I looked it up, and it said 1 in 91 children, and now it says 1 in 80 are affected by an autism spectrum disorder. So we are going to see an enormous influx of children that would benefit from massage therapy needing it. And on the news and everything else, almost every day if you change the channel, there's something, a movie or a news story or something about an autism spectrum disorder or ADD or ADHD. So it's becoming so mainstream that we need to figure out how to help these families.
Right. Well, you're not kidding about that. I don't even have children, but I notice that those articles are out there all the time. I have friends, more and more friends, that have a child affected by autism, and I have to say I didn't realize that the two, the autism and the ADD or ADHD, were often co-diagnosed, as you said.
Mm-hmm. Right.
That there were multiple problems or issues. I don't know if problem is the right word, but multiple challenges that those parents are dealing with, and they're definitely looking for solutions to manage and improve their child's way of life and care. With this class, obviously there's a lot of information that you could share, probably way more than you can include in 3 hours. What do you plan on covering during the 3-hour class at the American Massage Conference?
Well, during the class at the conference, I'm going to share with participants that are in the session some evidence and research behind the practice of pediatric massage therapy, and, of course, specifics in working with these populations that we're talking about, and when massage therapy is indicated, how you might use it, some different techniques. Some of the things that you use with children are not what you might use with an adult. Sometimes with an adult client, our picture of a massage session might be, if we utilize a table, that the client gets ready and maybe disrobes to their comfort level and lies underneath the sheets and waits for you to provide massage. Children are very different. So we're going to look at some different ways to approach them. And one of the things that I always include in any session that I do, unless for some reason the time limit is such that I can't, I always include something so that participants take away hands-on information. I learn very kinesthetically, and I think a lot of people in our profession do. And I also find it sort of a bad use of an opportunity when there's a massage therapy event or lecture that you attend and you don't take away anything you can use. And so we will do some hands-on practice right in class, and people will have some techniques and some protocol that they can take away and use with children in their own life or with a child that they might be working with in their practice. And it's not a bad time during our 3-hour session. Everybody will get a little bit of body work, which is always good to get some oxytocin levels going up.
Oh, for sure. Well, I know that's what a lot of people love most about going to conferences, is they get more body work perhaps than they do in a standard weekend.
Absolutely. That's why it's kind of fun for me when my class is uneven. I get to blend myself in and get a little body work as well.
Boy, I tell you, that is fun. It can make teaching, getting off the table and teaching again, a little more challenging too, but we need the hands-on work ourselves. Tell me, Tina, is there any particular background that a practitioner who's interested in doing this type of work should have? Any particular modality training or any particular I guess, skills or attributes just as a practitioner that would be helpful?
I think coming just from the very best thing that they can have is a love for children and families. And the reason why I say families, as much as pediatric massage might appear on the surface that you're always providing the massage yourself as the practitioner for that child, and you are very often, it's really important and valuable to include the families and when you can, when it's appropriate or not medically contraindicated, when you can teach them something they can use. It doesn't hurt your practice. It helps your practice. When they can do something in between your sessions, it helps that child. So I think that that's the very best skill you can have, is just the desire and the compassion for and wanting to help those families to affect their child's health most appropriately, and that's the one thing. And then just, of course, having a background, a really good, solid foundation in body work or a healthcare-related field where you understand anatomy and physiology, kinesiology, all of those types of things. And if you don't go professionally into an education realm where you learn enough about pediatric massage, if you haven't taken specifically a pediatric massage course, I think it would be really important that you have a good background of child development. And that's why special education in the area is really important. Children can be seen as small adults in one aspect, in that you should respect a child the way that you would respect an adult. But as far as growth and development, they are hugely different. And so it's really important that you have specialized education in that area before you just start working with a child client. Their bones are different, their skin, their soft tissues, everything's different. And even just how you relate to them, how you speak to them is hugely different. So it's really important to get some education in that area.
I would guess that you have some good resources for that you would share with people that come to your 3-hour class, and perhaps it's more training from you, of course, but that there are other alternatives or other avenues that you can tune people into.
Absolutely. There's a lot of background that you can blend. There's lots of different massage therapy and bodywork modalities that children respond really well to. And so I know there's lots of practitioners, and I think we all do it, that we either take lots of different classes or receive different types of body work and then blend specific techniques into our services for others. And you can do that with pediatric massage. So people that have a background in other types of modalities, it's a really good idea to consider using that information and then getting education in pediatric massage and blending it, because children will really respond well to lots of different gentle modalities.
Excellent. Well, I think that's a good point. And really, with any sort of a 3-hour class, I think it's important for people to remember that it's just basically an introduction, and it's not, okay, well, after this 3 hours, you're going to be prepared for every situation that could come up with this particular modality, that really more training is imperative. And I think in particular when you're working with minors, you do have some different guidelines that you have to follow, some other precautions that you have to take, but especially with the conditions that you're talking about. These, in some cases, I'm guessing you've got some kids that are a little bit maybe fragile, is that a correct word, or more, they're going to react stronger perhaps than someone who's not affected by autism might.
Absolutely. Children have, even your child that's developing typically, as healthcare would say, typically developing child, your healthy, well child, their response is different than an adult. And then when you add on different symptoms or diagnosis or those kinds of things, the reactions are significantly different. Even children that are sometimes on the autism spectrum, when they are nonverbal, you might work with them and people will ask, well, how do you know if they're nonverbal? How do you know if they've said yes or no to massage? And sometimes it can simply be that they didn't run away from you. is that they're engaged, that they're enjoying the session. So it's learning all of those things about every diagnosis that you want to work with is really, really valuable.
I'm sure that part of it just comes with practice and knowledge of the profession, but I would think that creating a good, solid dialogue with the healthcare practitioners that are involved with the treatment of these kinds of cases is going to be vital, too, to building both a practice that incorporates this kind of work as well as to the success of each case that you're working with. Do you offer any tips for how to dialogue with those professionals?
Absolutely, and that is really important. I think one of the things what I've found when working with healthcare, with specific practitioners in healthcare, and not all, but some practitioners in healthcare can see where there's an overlap in their professional scope and massage therapy, and sometimes that's a positive thing, and sometimes you're met with a little bit of a challenge in working with that professional, trying to help them to understand how massage therapy may actually work together with their therapy and can be helpful. And so there is a lot of information that I share about how to work with healthcare teams, how to talk with physicians and nurses and physical therapists, occupational therapy. There's so many different therapies that massage therapy works really well with, and it's just a matter of making those introductions and connections and helping people understand how we can work together. Massage it's really interesting for me. In the last 14 or so years, I've seen such a huge shift in healthcare accepting massage therapy in the United States. And it's really exciting for me because that gives our profession that professional stamp that we need and that mainstreams the profession so we're accepted as healthcare professionals. And I think that's really important for massage. And I'm just glad to see that growth happening.
I'm with you on that, and I know that a lot of people in our profession, if not everyone, is really right there with you. It's important for everyone in the medical community, the healthcare field, to accept massage therapy as part of, an adjunct or a complementary therapy, and recognize that it is valuable. So I think the work that you're doing and talking about is just amazing, and it shows how massage can really make a difference on such an important level with children. Because that's something that if you have an effect on a child and can improve something that makes their life better at that age, it's going to make their whole life better for their lifetime. Not that doesn't happen as adults, but kids.
Well, and it's true. And I think one of the funny realizations I've had is when I was caring for seniors and different populations. One of the things that I think really inspired my thinking with what you're saying about working with children and benefiting their life, it actually will in turn benefit us when we are those seniors in those residences or other places, because we'll have helped to nurture those people that will take care of us. So if we start now, it's going to make a huge difference, I think, even in our healthcare as we grow, because these will be people, these young children that are going to grow up, and they're going to be the adults that we're encountering and the people that are in charge of our healthcare. So I hope that the person in charge of my healthcare when I'm a senior is someone that had massage as opposed to someone who didn't. So I'm just hoping to make that stamp so that it changes. It changes everything, how they're compassionate with others if they're nurtured really young. So it'll definitely help us for the future if we put the time in now.
I think that's a beautiful sentiment. I couldn't agree with you more, and I'm really glad you said that, because it does just give one more reason why you want to introduce massage to kids. It's going to help us.
It is. What's the benefit for me? That can be one of the benefits. Even myself in my own life, I have a 2-year-old son, and he's been getting massage for a long time. And
Tina, we're getting a little bit of interference on your number or line there. I don't know if you can.
Is that better?
It's still a little bit fuzzy there. I'm not sure what the change is.
I don't know.
There, that's better.
There you go. Well, I was just saying that I have a 2-year-old son getting massage for as long as I can remember. And
yeah, I think it's doing it again. I don't know what it is. So, well, I don't know. I don't know if people can hear that or they want to. Yeah, Scott says on his end that he's losing the sound with you. So,
okay.
What I'm going to say is that we want to encourage everybody to learn more about your class, and we want to encourage them to visit your website, whether they can come to Atlanta or not. So tell me that web address again, where people can find out about you and the types of classes you offer. Hopefully that will come through.
Sure. It's .com. It has the phonetic spelling. So it's LIDELEKIEZ.com.
I heard all of that, but I don't think anybody else did. So I'm just going to repeat that out to everybody, and then I'm going to just remind everybody how they can sign up for your class. But Tina's website is littlekids.com. That's LIDDLEKIDS.com. lekidz.com, and we'll make sure to post that with your information on the conference, or on the recording rather. In the meantime, I want to just remind everybody that we want to invite you to be a part of the first American Massage Conference. This conference is put together by Scott Dartnell and his fantastic team, including Angie Patrick, Lorna, Robin, and Monica. A lot of you have met them at the Canadian Massage Conference, but they are doing a fantastic job in creating the first American Massage Conference, and you just have to be a part of it. This conference is incredibly affordable. Only $40 gets you access to 25 free one-hour CE classes. It also gets you admission to a trade show that will feature the top massage product manufacturers from across the U.S., and you'll be entered into a raffle for door prizes. I'm talking thousands of dollars of door prizes. If you don't get anything else out of it besides coming and getting entered into the raffle, it's well worth it. But as you've heard, there's a lot that you're going to get for that $40, including the first ever National Massage Therapy Job Fair, which is going to be held on Sunday, the 22nd. Of course, that's in May. And you don't have to be an Atlanta resident to benefit from this job fair. There will be national, state, and local employers on hand. So your $40 ticket might enable you to walk away with a new job. Of course, you are welcome to sign up for over 100 hours of CE from a variety of instructors, including Tina. These are available through 3-hour classes, half-day sessions, full-day classes, and 2-day workshops. I'm sorry, there are no half-day classes. It's just full-day and 2-day, as well as the 3 hours. And if you're a student, we also have a free student day with a Smart from the Start presentation and Laura Allen's free full-day class on passing the NBLEX and NCB exams. That's sponsored by ABMP and includes, for the first 70 people that register, a free copy of Laura's book on how to pass massage therapy certification exams, and that's donated by her publisher, Lippincott. Of course, we'd also like to invite you to attend the Saturday night gala. There will be food, drinks, and live entertainment, so be sure to get your tickets for that event when you register. If you're needing to stay at a hotel in the area, which many of us will, the hotel is incredibly affordable. It's only $121 a night. Whether you choose to have a room to yourself or split it with up to 3 other people, you can afford to come to Atlanta. It's a great conference, a great bargain, and something that I think is going to be an event to remember. I also want to remind everyone that the show guide is going to make up the center spread of Massage Today's May issue. This guide will go out to over 62,000 massage therapists and will be available free at the show. This is the first nationally circulated conference show guide and it has some really good advertising opportunities. So if you are a vendor or an educator or product manufacturer, you want to reach those 62,000 therapists that are going to get this guide, then you need to advertise in here. So please contact Sandy Pierce at Massage Today for information and details on being a part of the show guide and getting your name and company name out there to all the attendees and those other 62,000 therapists. Of course, the American Massage Conference could not happen without the support of all of our global sponsors, including Massage Envy, Massage Warehouse, ABMP, and of course, Massage Today. We thank all of them for their support in this year's event. If you would like to find out how you can attend the American Massage Conference, May 20th through 22nd in Atlanta, Georgia, meet Tina and attend all of the classes with the amazing presenters at this year's inaugural event, please visit the official conference website at www.americanmassageconference.com. We also invite you to stay connected with us on Facebook at www.facebook.com/American Massage Conference. I hope after today's discussion that everyone listening is ready to come to Atlanta and to take Tina Allen's class, Pediatric Massage, highlighting massage for autism and ADHD and ADD. Tina, thank you so much for taking the time to talk with me today, for sharing your passion and knowledge about this topic. It's just been very enlightening. I know I'm looking forward to your class at the American Massage Conference and getting to meet you in person.
Thank you so much for having me. I'm looking forward to being there and seeing everyone in person myself. And so I hope that lots of you listening today will come up to Atlanta.
Okay, well, thanks. I'm not sure if everyone got that or not, but Tina, we're so glad that you were with us today. And again, I'm Felicia Brown. On behalf of everyone from the American Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the American Massage Conference pre-conference broadcast series. Please remember to check back for upcoming interviews each week between now and May 20th. We look forward to seeing you in Atlanta. Thanks again for tuning in, and have a fabulous day.
Come again.
Let there be plenty. Let there be plenty love. Let there be